Good afternoon, everybody, and thank you very much for joining us this afternoon for this webinar presentation called Starting the Medicare Conversation. Before we begin the presentation, I do want to let you know that there will be an opportunity for questions and answers. To ask a question, or if you think of a question during the presentation, just type it into the GoToWebinar control panel that you see there on your computer screen, and I'll be sure to address all questions at the conclusion of the presentation. Of the 10,000 baby boomers turning 65 every day in our country, many may be your clients who have come to trust you for other important insurance and financial coverage throughout their lives. A 2017 study from Merrill Lynch, in conjunction with AgeWave, states that less than 15% of those nearing retirement feel that they have a trusted resource to help them understand, prepare for, or manage retirement health-related expenses. Some 70% of married pre-retirees had not even discussed with their spouse health care in retirement and how to pay for it. These people are your clients who need to know that they can turn to you for their Medicare guidance and answers. This presentation will provide you with some important talking points and concepts and provide an overview of Medicare so that you can be able to confidently initiate this important conversation with your clients and provide more value to your client relationships. It's important that insurance advisors need to move their focus from helping clients accumulate wealth to helping them preserve and protect it. It is important to educate your clients on the costs of health care in retirement years. The Center for Medicare and Medicaid Services, or CMS, estimates that Medicare's total annual cost for people in good health is $7,620 in 2017. Those who have chronic conditions like diabetes or heart conditions can expect to pay as much as $12,000 or more per year. This estimate applies to retirees with just traditional Medicare insurance coverage and provides a general idea of the monthly expenses associated with Medicare premiums, co-pays, and deductibles, and even prescription drug out-of-pocket costs. Fidelity does another study that says that a 65-year-old couple retiring in 2016 will need an average of $260,000 to cover medical expenses throughout their retirement. An additional $130,000 is needed to insure against long-term care expenses. It's important to tell your clients that you can help them to be protected from these high out-of-pocket expenses. In many situations, you will know your client's age, but you may be unsure of the coverage that he or she has. And you can ask these simple questions to begin this important Medicare conversation. In regards to your health coverage, are you self-insured? Do you have a Medicare Advantage plan or a Medicare supplement? How are you paying for your health care costs, and how do you plan to pay for them in the future? If your client already has coverage, you may simply ask them, if I may review your coverage, I may be able to save you money and improve your benefits. If you're unsure of their coverage, you can say, I can help you choose the Medicare coverage that's best for you. If your focus is financial planning, where you sell annuities and life insurance to help your clients preserve their wealth and savings for their retirement years, it is important that you incorporate health insurance costs into the overall financial picture and how you can help them save money on health care, the highest expense in retirement. When you don't tell your clients you can advise them on health care expenses and coverage options, you risk losing all of their business to another advisor who does. When one turns 65 and is on Medicare, there are two options available to help them pay for Medicare's out-of-pocket expenses. There's a Medicare supplement plan or a Medicare Advantage plan. And if you're going to be able to initiate the conversation, it's important that you get a general idea of what each option covers. When the conversation hasn't, in fact, turned towards the specifics of coverage, you need to point out the out-of-pocket costs that original Medicare Part A and Part B leave for the beneficiary to pay, and how a Medicare supplement plan can pay for these costs. Medicare supplement plans, also known as Medigap, pay for the gaps, the deductibles, co-insurance, or co-pays in original Medicare Parts A and Part B. It's very important to point out to your clients that if they were to just stay on original Medicare Part A and Part B, and not ever get a Medicare supplement, they would have to pay the $1,340 deductible out of their own pocket if ever admitted into a hospital. That's quite an expense for many seniors. Most Medicare supplement plans, including the two most sold plans, F and G, pay for this deductible. This alone can justify the cost of a Medicare supplement plan. It's also important to note that Medicare supplement plans have affordable monthly premiums with no network restrictions, which makes them especially attractive for travelers and snowbirds who make their home in a warm weather state during the winter. Also, those on the Medicare supplement plan incur little to no out-of-pocket exposure, and the benefits are standardized, meaning that the benefits with one carrier are the same with any other carrier. Further, one of the most attractive features of a Medicare supplement plan is it offers an additional 365 days of hospital coverage. Original Medicare will pay for up to 150 days of a hospital stay, but a Medicare supplement plan will pay for an additional 365 days of coverage. Further, Medicare Supplement Plan G can provide significant savings to a Medicare Supplement Plan F when the difference in premium is considerably more than the $183 per year, which is the cost of the Part B deductible that Plan F normally pays for. Also important to note that most carriers do not require any additional certification to sell Medicare supplements. Agents just need to have an active health insurance license to sell a Med Supp. Medicare Advantage plans, or Part C, are a Medicare health plan. A Medicare health plan is a plan that's offered by a private insurance company that contracts with Medicare to provide Part A and Part B benefits to people with Medicare who will enroll in these plans. Medicare health plans include all Medicare Advantage plans, Medicare cost plans, and PACE plans, which are programs for all-inclusive care for the elderly. Most Medicare Advantage plans are network-based plans like HMO or PPO plans that contract and set up networks with certain medical providers. In rural communities, without access to these networks, certain carriers offer private fee-for-service plans that are not bound by a network. Medicare Advantage plans also include special needs plans and Medicare medical savings accounts. Most Medicare Advantage plans offer prescription drug coverage, but some do not. Medicare Advantage plans require policyholders to pay Part A and B premiums, but cost zero to little premium per year in exchange for higher out-of-pocket costs like the deductibles, copays, and coinsurances. Medicare Advantage plans are often capped at annual maximum out-of-pocket costs anywhere from $3,400 to $6,700 per year. And some Medicare Advantage plans include benefits that are not part of original Medicare, so they're very benefit-rich packages. They can include, benefits like dental, hearing coverage, and can have some added perks like gym memberships and access to nursing lines. It's also important to note that in order to sell Medicare Advantage plans or even market them, you need to be certified with each carrier that you intend to sell. Prescription drug plans are offered by private insurance carriers for a premium. They are tiered drug plans with copays, where each drug is classified to a specific tier and each tier has a corresponding copay. These can be standalone plans or tied to a Medicare Advantage plan. And again, in order to sell a prescription drug plan, either a standalone plan or one that's combined with a Medicare Advantage plan, you also need to be certified to sell. Now that we have covered some of the basics of Medicare Parts A, B, C, and D, and Medicare supplement plans, I want to review some strategies to help you advise your clients about their healthcare costs in the retirement years. Medicare is all about a trust sale. It's important to build upon the trust you already have established with your clients. Seniors are clamoring for guidance on their Medicare choices, as I previously mentioned with that study from Merrill Lynch that said less than 15% know someone that they can go to. So it's important that you be sure to offer this guidance on the best options available to your clients. Further, it's important that you don't pigeonhole your marketing efforts to people turning 65. The 40-year-old client who trusts you for his life PNC coverage will certainly want to refer you to his or her parents or loved ones for Medicare guidance. So be sure to market Medicare to people of all ages, or at least let people know that you can advise them or their loved ones. Selling Medicare plans offers tremendous value to the client relationship. It's important that you don't just sell one policy, because if you only sell one policy to your client, you risk losing them to someone who can offer a more comprehensive portfolio. Property and casualty carriers and their agents master the bundle concept, where they sell home, auto, boat insurance, and even life insurance to their clients. Why not Medicare supplements too? When an agent or advisor incorporates this bundle concept, they become a one-stop shop for their clients' insurance coverage. Each additional policy sold can dramatically increase clients' persistency, which can put more money in your pocket, and more importantly, it strengthens the relationship that you have with your clients. A very important part of the Medicare conversation is making sure that you're asking your clients the right questions. For example, you should ask, how do you pay for your dental care? Could you use some extra cash to cover a hospital stay? What happens if you get cancer? Are you insured in the event that you would be confined to a facility? These are common needs among seniors. And in addition to a Medicare supplement policy, a senior dental policy, a cancer coverage, and a short-term care plan, or even a hospital indemnity plan can provide even more necessary coverage that your clients could really benefit from. Just asking these simple questions can strengthen the relationship you have with your clients and lead to more sales. Are you leaving money on the table? Each time you don't ask those questions that I just mentioned, you certainly are. Asking those questions can lead to a sale up to 50% of the time. One of the tremendous benefits of selling Medicare supplement plans is levelized commission. In this chart, you will see the compound effect of offering Medicare supplement plans, the compound effect that it can have in the money that you earn. Most Medicare supplements offer level commission for 6 years. This example shows a 20% commission. And through the compound effect, you earn your commission each year for your new business sales, but beginning in year 2, you earn your new business commission plus your renewal commission on existing business. So with this example of just Medicare supplement sales with a $1,500 premium at 20% commission, after 6 years, you are earning more than $90,000 in just Medicare supplement sales. Now, if you add a dental policy or another ancillary product, you'll be earning more than $100,000 on your senior health business alone. Once your client realizes the importance of purchasing a Medicare supplement, you can turn the conversation towards the specifics of the carrier that you're offering, that's offering the most affordable options for your client. You can focus on the carrier's brand recognition, the financial strength of the carrier, or the superior customer service that it provides its clients and policyholders. It's important to ensure the business transaction by submitting the application electronically. The application can be issued within minutes, and many carriers offer a temporary insurance ID card that is emailed to their applicants within just a few hours of completing an e-application. And certain carriers that are offering multiple options make it incredibly simple for you to offer your clients additional products like dental coverage with just a simple click when using their electronic enrollment process. It's important to know that the Medicare conversation is not a difficult conversation to start. Knowing the simple basics of when to enroll, the options that are available, and what is covered is extremely valuable. Making it even easier is that Medicare supplement plans are standardized, so you don't need to understand which carrier is offering which benefits. So as long as you know that the benefits of a Medicare supplement plan, again, the same benefits are provided with each carrier. This makes it simple for you to demonstrate the benefits of a Medicare supplement plan provides. And again, if you don't know the answers, just give us a call here at Art Jetter & Company, and we'll be glad to answer any questions that you may have. One of the premier tools that we offer at Art Jetter & Company is our access to our Medicare supplement quote engine for all of our appointed producers. This tool allows agents the ability to shop the market for the most affordable options for your clients and provide them with customized quotes. Further, it's not just a Medicare supplement quote tool. You can also have the ability with this platform to quote final expense, dental, and hospital indemnity plans all on one platform. And the quote that you will provide will include more than just the rate. It also includes an outline of the benefits each plan provides and other important information like the carrier's experience and AM Best rating. Be sure to visit our website at jetter.com to request access to this tool. I do want to open it up for any questions that anybody may have. If you do have questions, please again type that into the control panel that you see there on your computer screen. One question asks, what plans can be sold at this time? It's a great question. Medicare supplement plans can be sold at any time of the year. They can be sold, most commonly sold to people during their open enrollment period, which is a 6-month period that begins the first of the month that one has Medicare Part B. It's often affiliated with the person being age 65, but if somebody can get a Medicare supplement if somebody gets Medicare Part B at, say, age 70, that triggers their open enrollment period for a Medicare supplement plan when the carrier at that period is required to issue any plan that's applied for. You can also sell Medicare Advantage plans to people who are just turning 65, 3 months before their 65th birthday, the month of their 65th birthday, and 3 months after. Some of the added perks that we offer here at Jetter & Company, when you get appointed with any of our carriers, we will provide you with customized calling lists of people who are Medicare eligible in the counties in which you choose. All the lists that we provide are scrubbed against the do not call registries, so if there's a phone number included in the list that we provide you, you're welcome to contact that prospect and talk to them about their health care costs in the retirement years. Does the Medicare supplement plan include in their extra 365 days apply to nursing home as well? No, it does not. That only applies to inpatient hospital stay. Medicare, when it comes to nursing home care, provides up to, I believe, 21 days of coverage for skilled nursing facilities. Does the deductible change from year to year? The deductible does change from year to year. However, the Part B deductible this year remained the same as it was in 2017. The Part B deductible is $183. The Part A deductible did increase to $1,340. I believe it was $1,326 in 2017. Yeah, the quote engine is free to any of our appointed producers. So if you're appointed with any of our carriers, we'll send you an email with a link to our website to request access, and we'll certainly approve access to anybody who's appointed with any of our Medicare supplement carriers. So one question, final question asks, can we compare and contrast Medicare supplement versus Medicare Advantage? What is the best way to present this to the client? I can be glad to send out a spreadsheet that I've compiled that really shows and highlights the differences between Medicare supplement and Medicare Advantage. Some of the initial things that come to mind: a Medicare Advantage plan is a managed care option where you're bound by networks, and they have to use specific in-network providers to access their care. With a Medicare supplement plan, you can go to any doctor that takes Medicare anywhere in the country. Also, with Medicare supplement plans, you pay your monthly premium in exchange for little to no out-of-pocket costs. With a Medicare Advantage plan, you pay no monthly premium, zero to little premium per month, but in exchange you have higher out-of-pocket costs. You pay for co-pays every time you visit your doctor or your specialist, or if you have go to the hospital, you pay a certain inpatient hospital stay co-pay for a certain number of days. And these co-pays and maximum out-of-pocket costs on a Medicare Advantage plan can range anywhere from $3,400 to $6,700. So I often tell agents that we work with that they want to tell their clients that with the Medicare Advantage plan that you're looking at, kind of assess their care now and how often they're using their medical providers. And if they think that their annual costs will exceed the annual cost of the Medicare supplement premium, it's probably better to go with the Med Sup. But if they feel that they're not going to visit the doctor that often, then possibly a Medicare Advantage plan would be a more cost-effective plan for them. Anyways, that was some excellent questions. I really appreciate everybody's participation. And if you have any further questions, please email us at seniorhealth@jetter.com. This presentation has also been recorded, so be sure to send a copy of this recording to anybody who attended today. And again, I thank everybody very much for joining us this afternoon, and hope you all have a great rest of your day. Thank you very much.